Well, hello and welcome to the first session in CORE Canada's new health promotion series, Reorienting Health and Social Services for Older Adults, Provincial Strategies for Community-Based Senior Services. My name is Barbara McMillan and I'm the Provincial Community Engagement Coordinator for United Way British Columbia's Healthy Aging Department and one of the team involved with CORE Canada, the Pan-Canadian Healthy Aging Knowledge Hub. We humbly acknowledge the traditional and ancestral homelands of the Indigenous places in this place we now call Canada, and honor the many territorial keepers of the lands on which we live, work, play, and gather. Thank you for joining us today. There are close to 350 people registered for this session. I'm not sure that they'll all make it on, but to help things run smoothly, everyone except the presenters will remain muted with cameras off. However, we would love to know who you are and where you're joining from, so please introduce yourself in the chat box. There will be an opportunity for a few questions towards the end of the session. Please use the Q&A feature for that rather than the chat box, and also note who you are directing your question to. The session is being recorded and will be posted on CORE Canada. That's healthyagingcore.ca. And there will also be follow-up with those interested in continuing today's conversation, and you'll hear about that a little bit later. And one more thing, we have a slight change to our program today. Unfortunately, Kahir Lalji is unable to be with us, so I'll be your moderator for this event. So why are we here? Well, today's conversation emerged from some earlier conversations, ideas, and activities stemming from the publication last year of Promoting the Health of Older Canadians, The Canadian Experience, an edited collection by Irv Rootman, Peggy Edwards, Melanie Levasseur, and Fran Grunberg. Subsequently, Health Promotion Canada and the National Collaborating Centre for Determinants of Health produced a series of webinars based on the book that explored public health action on health equity for an aging population. The webinars generated significant interest and created momentum towards further using the book in the webinars as a foundation for generating more interest and action around applying a health promotion framework to guide the policies, practices, programs, and services that support seniors in Canada. And so the idea was conceived to develop this new series of monthly 90-minute sessions aimed at mobilizing to promote health and well-being for older adults. Joining Irv, Peggy, and Fran in planning the series were Diane Eichel, Marcy Cohen, and me. And it's been a real privilege to work with such an esteemed and knowledgeable group of health promotion activists. And I'd like to take this moment to recognize their tremendous contributions and their shared passion for supporting and advancing healthy aging in Canada and making a difference in the lives of older adults. Now, these new sessions are not webinars, rather they're aimed at mobilizing action on various issues by focusing on effective health promotion models and the policies, practices, partnerships, and the networks that support them. Through interviews and discussions with practitioners, researchers, and policymakers, each session will explore a topic and the key issues and challenges related to it, and examine some strategies and programs that have been successful in addressing the problems. Further to the presentations, participants will have the opportunity to more deeply probe and engage in the topic by accessing related resources and tools and by joining a discussion group on CORE Canada. The goal is to generate conversation that leads to action and change, all in support of advancing independent living for older Canadians. Our first session focuses on provincial strategies for community-based senior services, or what we often refer to as the Cbss sector, the thousands of organizations and communities across the country that provide seniors with access to a range of low-barrier programs, typically in 7 core areas: nutritional supports, health and wellness programs, physical activity, education, recreation, and creative arts, information, referral, and personal advocacy, transportation, and affordable and accessible housing. These programs and services are offered through a range of local government and nonprofit agencies, including senior centers, community centers, neighborhood houses, community coalitions, ethnocultural organizations, and multi-service nonprofit societies, among others. Research confirms that these services are essential in supporting older adults to develop new social networks, remain physically and mentally active, and live independently in their own homes and communities. Importantly, they also improve outcomes for those who are vulnerable to problems, such as those resulting from social isolation, low income, and frailty. So, without further ado, we'll introduce today's presenters, all of whom are leading efforts in their provinces to reorient services for older adults. Marcy Cohen, co-chair of the Community-Based Senior Services Leadership Council in British Columbia, has over 35 years of experience working as a health and policy researcher, educator, and advocate. She has published over 35 articles focusing on seniors care, healthcare reform, and workforce equity, and has been involved in social justice issues as a professional and volunteer for most of her adult life. Now retired, although it doesn't seem that way with her deep involvement, Marcy is increasingly interested in promoting resiliency in older adults and supports this interest through her volunteer role with United Way. Sue Hesterdal has been Executive Director of the Older Adult Centres Association of Ontario since 2011, having previously served on the OACAO Board of Directors and the Executive Committee since 1996. Sue has a 30-year history of working in the not-for-profit sector, specifically with older adult centres. During her tenure as Executive Director of the Square One Older Adult Centre from 1994 to 2011, Sue developed and implemented a seniors charity. She has a BA in both psychology and gerontology from McMaster University, and her current role with OACAO involves community development and partner collaboration, financial and project management, government relations, and advocacy initiatives for the Seniors Active Living Centres sector. She is an active community volunteer, holding many roles in her local community. Helen Mcdonald is Executive Director of Community Links, a nonprofit organization in Nova Scotia. And Helen, we are so glad that you have power and you can be here with us and that you're safe. Community Links where Helen has been for over 30 years, has connected individuals and senior serving organizations, sharing information and resources so older adults can remain active, engaged, and valued in their communities. Helen sits on the Seniors Advisory Council to the Government of Nova Scotia and the Nova Scotia Centre on Aging Advisory Board. In 2018, she was a fellow of NS GovLab, an initiative of the Nova Scotia Department of Seniors using social innovation to find new ways to support older adults. She's an award-winning mental health advocate and founder of Women in Wellness, an awareness and fundraiser that has raised over $1.5 million for the Canadian Mental Health Association. Trained as a journalist and lawyer, Helen is mom to 2 adult children and a puppy named Willow. Karen Mcdonald is Executive Director of Sage Seniors Association in Edmonton, and her career has focused primarily on the field of gerontology, including a decade in senior supportive housing and more than a decade with Sage Seniors Association, most recently as Executive Director. SAGE is a community-based senior serving organization that provides social services, community development, and life enrichment programming. Karen is also currently acting as chair of the Community Leadership Council of Healthy Aging in Alberta, working with Cbss organizations across the province to advance sector development to best meet the needs and build on the strengths of seniors living in community. In 2015, Karen co-founded Matchwork, an interactive employment training and assessment tool used by employment support organizations to more effectively guide and support those who face barriers to employment, including older workers and caregivers. Karen completed her MBA and BA at the University of Alberta, is a past Rotarian, and has recently joined the board of the Matart Foundation. Over the past few years, I've learned about some of the innovative work these individuals and their organizations are leading to advance our sector and benefit seniors in their provinces and beyond. And I'm so pleased we could bring them together today to share some of their experiences with participants. So thank you all and welcome Marcy, Sue, Helen, and Karen. So we're going to start. I've given some brief introductions and background for your organizations, but we'd like to hear more about the history of your organization and why at this moment working together and raising the profile of the CBSS sector is so important in your province. Let's start with Marcy.
Thank you. Lovely to be here to connect again with my fellow panelists and with all of you from across the country. So in BC, we have 2 provincial initiatives in the last 10 plus years, both led by the United Way and both focused on health promotion that I want to talk about. The first is the Better at Home program that began as a recommendation from government-appointed Council on Aging. That council heard very clearly from so many stakeholders that they had consulted that the government home support programs, because of lack of funding, were becoming increasingly narrow-focused and crisis-oriented. And that if we were going to support seniors to age well at home, we needed to put more money and focus it specifically and exclusively on health promotion. And so that recommendation came, and then the decision to use the United Way as the vehicle for building better at home programs. And that kind of made a lot of sense because it actually created the opportunity to build on the health promotion work that was already going on in community agencies around the province, and then to add additional services that the government home support was no longer providing. So things like grocery shopping, friendly visits, transportation, housekeeping. The program began in 2011, and there are now more than 100 sites across BC, all seen as essential services, all well loved by seniors, their families, and local politicians. Now, I have to say that there were certainly some problems in the design, way too much focus on volunteers, particularly in areas like housekeeping. And now, in our post-pandemic world, additional enhancements and additional services needed. So all of which we're looking at right now. The second initiative came directly from community leaders, and it was in 2015. And these leaders could see the very vital role that was being played by the sector in terms of promoting healthy aging, but were super concerned because at the time, the exact opposite was happening. That the funding, which was already short-term and limited, was in decline in many communities. And these community leaders felt very strongly that this sector needed a much higher profile and more funding if BC was to effectively meet the challenges of an aging population. And in response to that call, a small foundation stepped up and provided seed funding to start a provincial network. This network, now called the Community-Based Seniors Leadership Council, includes leaders from nonprofit agencies, municipal leaders, as well as seniors like myself who are volunteer leaders in the sector. Initially, it operated independently. It is now situated within the United Way and supported by the United Way staff. At an early meeting of the network, agencies acknowledged that they were isolated and divided from one another because of this competition for funding that set them in opposition to one another at the very time when they needed to be working collaboratively and building a business case for increased funding for the sector as a whole. And since the inception of the Leadership Council in 2016, that has really been the focus of our work. And we've argued for that business case in 3 different ways. First, by building a relationship with the Ministry of Health right from the beginning, based on our common goal to support more seniors to live well in their own homes. Secondly, by really providing the government and the community with accessible research, gathering together the considerable research that exists in Canada internationally that already shows that strength-based health promotion activities provided by the sector improve health outcomes, lower the risk of frailty, and as a result, significantly reduce the use of expensive hospital and long-term care services. So no question, the research is there. And then thirdly, and probably most importantly, in terms of what we as a sector have to add in terms of value, is the community development approach. That approach that makes it possible for us to identify successful local programming initiatives and then share and scale them up province-wide. And also that approach that makes it possible for us to really learn about the challenges and service gaps that exist, particularly for vulnerable low-income seniors from marginalized communities, and to begin to build the capacity to address these needs locally, regionally, and provincially. So based on that 3-pronged approach, we did succeed in getting provincial funding in 2017 for some provincial infrastructure on capacity building and outreach, and then program funding in 2020 and 21 in 5 programming streams for about a total of 75 programs. So we were doing well, and then the pandemic hit and everything changed. And in the first months of the pandemic, there was a recognition of senior services in the media and in the public as never before, and we were considered an essential service. And because we were networked provincially, the BC government and the Seniors Advocate asked the United Way to support seniors across BC to shelter at home. Huge opportunity. But interestingly, by the fall of the next year, 2021, many seniors had moved on who only needed temporary support. And those who remained were a very vulnerable group of people for whom access to our service had become a lifeline in terms of food security, social support, and practical assistance. So when you think about it, in 2020, we were funded with programming dollars to reverse and prevent frailty. What came at us instead was a tsunami of vulnerability and frailty. Increasing referrals are now coming from the health system. Increasingly, our sector is being asked to support frail seniors when they return home from hospital. And increasingly, many of the seniors returning to our in-person programming in our centers are experiencing reduced mobility and deteriorating health. But at the same time, and probably because of all this, there is more interest and support from the ministry in working with us. More willingness to work collaboratively, more willing to think about how the sector is funded overall, more willing to think about forming an interministerial committee and developing infrastructure. And so it is a difficult time, but also a time with quite a bit of promise. Thank you.
Sorry, I was muted. So let's go next to Sue for the same question.
Thank you, Barb. And hello, everyone. As you know, I'm Sue Hesterdal. I'm the Executive Director of the Older Adult Centres Association of Ontario, the OACAO. And we're a nonprofit charitable organization that currently represents well over 220 organizations currently represents over 220 organizations, which include Ontario-based not-for-profit and municipally run seniors active living centers, older adult centers, and seniors serving organizations who support over 200,000 older adults and seniors to stay active and engaged in their communities. Our mission statement is to be recognized as a leader in the development of quality services, resources, and supports for our network of community-based older adult centers. And as the voice of older adult centers and seniors active living centers in Ontario, we serve our members in 8 different regions of the province with older adult volunteer and staff representation from each region on our board of directors. The OACAO is a strong and well-respected provincial association that supports and builds capacity for the seniors active living center sector. And we've been a provincial umbrella organization across Ontario since 1973. There are currently 299 provincially funded SELC programs, which are run by just over 220 SELC operators, and the majority of SELC operators are members of the OACAO. Our members come together to unify their efforts towards the development of comprehensive programs and services for older adults to offer resources, training, networking, and opportunities to support and engage the staff and volunteers responsible for the operation of the centers. Now, to provide a bit of history about the OACAO, I dug back into our history books and our advocacy files, and it's really my pleasure to share this information. The OACAO has a long history. Has a long history and has influenced and impacted the work that we've done collaboratively with the Ontario Ministry for Seniors and Accessibility at different levels of government. The beginning of the Senior Centre movement in Ontario dates back to the first Ontario Conference on Aging held at the University of Toronto in 1957. It was spearheaded by a committee of concerned citizens, and the conference was the first of its kind in Canada, with 500 full-time and nearly 200 part-time registrants drawn from 53 Ontario communities, as well as representatives from Quebec, New Brunswick, Manitoba, Saskatchewan, and the federal government. The conference had 2 main objectives: to find out what the challenges of aging were in Ontario and to find solutions, and to provide an opportunity for those working in the field to learn from each other's activities and discuss coordinated plans for the future. Over 70 resolutions were formulated, including a proposal to establish a suitable Ontario organization to provide information and assistance to those working with and for older people. The first senior centers in Canada had emerged by the late 1940s and early 1950s, with the Second Mile Club in Toronto in 1947, Gordon House in Vancouver, 1951, and the Good Companions Day Center for Senior Citizens in Ottawa in 1955. The main impetus to the formation of new centers came with the Government of Ontario passing the Elderly Person Centre Act in 1966, proclaimed in 1968. And the EPC Act allowed the funding of a maximum of $15,000 a year, or 50% total of their total program budget, with the proviso that is still in place that the city or municipality must contribute at least 20% of the net shareable budget as well. That ceiling of $15,000, generous as it was in 1968, became a source of constant complaint as inflation increased over the years. At the fourth conference in 1973, the present OACAO Association was born. It was in Geneva Park in May of 1973. Participants formally endorsed the establishment of the Senior Citizen Centres Association of Ontario. And the association continued their strong advocacy work for the sector. It wasn't until the 80s that the organization dropped the word citizens. Senior Centre Association of Ontario was the name. But then once we incorporated in 1982, the name, the Older Adult Centres Association of Ontario, was established. It's long believed that older adult centres are one of the best kept secrets within the healthcare system, and it's our belief that centres provide great health promotion benefits that add to our healthcare system and provide age-friendly, accessible, and inclusive programs and services for seniors throughout the province. Centres are a community hub in their neighborhoods with partnerships with community organizations, making them strong. Older adults in Ontario today face increasing health risks driven by several social determinants of health, including poverty, lack of social connections and support networks, lack of physical activity, and a lack of information on how to manage chronic diseases. Older adult centers promote healthy, active aging and engage seniors with a wide range of activities. A study that was done by the OACAO in 2013 called Measuring the Impact of EPCs in Ontario concluded that centers, their member experiences reduces isolation, improves wellness, and they make healthier choices. In 2014, the Elderly Person Centre program transitioned from the Ontario Ministry of Health and Long-Term Care over to the Ontario Senior Secretariat. And it is now managed by a standalone ministry, the Ministry for Seniors and Accessibility. Sorry, I'm wrapping up now. We've advocated for a long time over the years to strengthen the EPC program. And after many years of advocacy, the funding increased from $15,000 to $30,000 and currently sits at $42,700 per Seniors Active Living Center program, or as it was called, Elderly Person Center Grant, as a maintenance and operating core funding piece. There's also a provision for a special grant to a maximum of $15,000 that SALCs apply for each year. In the 2017 Ontario budget, the government made an additional investment of $8 million over 3 years to add an additional 40 Seniors Active Living Centers, or Elderly Person Centers as they were called at the time. This brought the annual funding portfolio to $14.1 million, and that is currently supporting just under 300 Seniors Active Living Centers, as the EPC Act was modernized in 2017 to be called the Seniors Active Living Centers Act. The OACAO has been involved with the advocacy all along the way and is very closely connected to the Ministry for Seniors and Accessibility. And I just want to say that the OACAO will be celebrating our 50th anniversary next year.
Great, thank you, Sue. We're going to go to Helen next.
Hi, and thank you very much. I'm speaking here from Halifax, where we do have power, but we are more fortunate than many of my fellow Nova Scotians who are still without power. Many are struggling without running water. There are hundreds and thousands of trees down across roads and lines, and people are trying to kind of put their lives back together and you know, come through this latest storm, because it almost feels like it's another wallop, not unlike COVID and the sudden slamming into us and the ongoing impact. And because of that, and for the last number of days, I've been anticipating the storm, preparing for the storm, living through the storm, and now responding through the storm with preparation of a microgrant that's going to go out to area community organizations to help bring some resources to folks who are struggling the most. So I'm feeling not as prepared as I'd hoped to be for this particular presentation. So I'm being very Canadian, asking your forgiveness for that. But to share with you a little bit about who Community Links is and what it does. It's an organization, we're not quite as old as the one that we just heard about from Ontario, but for the past 30 years, Community Links has been active in Nova Scotia, bringing together older adults and organizations that work with and for older adults. 30 years ago, it grew out of a grant, out of a study that was going on around the province looking at health and health needs of Nova Scotians, and there was a recognition by the panelists that there is all these really good initiatives happening in very rural and remote parts of the province often by older adults, projects, caring community activities, but they weren't being shared beyond the very local place where they were and happening, and the ideas and the notions and the knowledge wasn't being shared beyond the very hyper local areas. So as these folks went across the province and they heard over and over again what was happening in, rural Cape Breton and down in Briar Island off Digby and on the Knoll Shore and different areas, they realized like all this good work was happening, and could there possibly be an opportunity to bring these folks together, share what was going on, help elevate the voice of older adults, and create some advocacy opportunities and training, but also recognize the strength and the contributions that older adults were making to our province and to the well-being of our population. So from kind of very grassroots recognition grew a project that then became in 1992 Community Links, and it kind of was run by volunteers with some New Horizons funding, and then it got enough funding to be able to run as an organization, and then it for a while had no funding and was only run by volunteers, and then I think around 2008 or so, funding became available through the Nova Scotia Department of Health to do work on fall prevention. And as most of you know, fall prevention is critical to the well-being of older adults, and there's many elements to that. And Community Links, for a number of years, became kind of the go-to organization, doing all kinds of awareness training, both for healthcare professionals, but also working with older adults in their groups and organizations. Developed materials, falls prevention, worked on a falls prevention strategy, traveled around the country addressing some of those needs and sharing the resources. As the recognition of the importance of fall prevention was picked up and work was being done by other organizations, Community Links moved away from that to more of a age-friendly community focus, say about 2012. Funding continued to come from the Department of Health, the Provincial Department of Health. And Nova Scotia was one of the early locations where age-friendly community projects were initiated in Canada, or were trialed, both in Halifax and in Guysborough, which is a very rural community or county, and in other locations, age-friendly work plans were developed, work was done. Community Links was part of that, and we had regional coordinators who were participating, assisting, bringing together coalitions of players, everyone from recreation workers, BON, women's centers, all kinds of folks coming together to discuss issues around what age-friendly means in community. That work has continued, but funding for us continues to come from government, but for 20 years the funding was the same. So slightly over $250,000 20 years ago was continued to be the funding until this past year. And so, as you know, inflation hasn't kept costs the same. So that meant the organization has somewhat shrunk. So it's a challenge, and yet it's a time where we know more people are coming into their later years. More issues are becoming apparent about why it's so important to support and ensure people have an opportunity to stay at home, stay in community, and remain engaged and be valued for all that they do and all they contribute. So we've kind of moved with the tide, tried to navigate the changing realities, and tried now with more part-time than full-time workers to kind of address issues by continuing to bring together coalitions, by supporting seniors clubs and organizations, and by raising awareness, being a voice at the provincial level and where we can be, to talk about why it matters, why we need to celebrate who older people are and all that they do and bring. I would say that we have a government here that's actually I'm encouraged by, because we have a new government right now that's investing a significant amount of money into understanding what the needs are for older adults, because the reality is more than 25% of our population is going to be 65 and older, and they know that 25% of the population can't all decline and need long-term care beds, that people need to be supported, need to be able to stay in community, need to be able to live their lives well for as long as possible. So we've actually been tasked with doing an assessment, a current state assessment of the needs and gaps and opportunities across the senior serving sector. And it couldn't come at a better time. We've got a significant investment that's going to help us re-engage with more staff across the province, but it's also going to help us and other players, all players, we hope, understand who's doing the work, how can we work together more collaboratively and more seamlessly, and where are the gaps, where are the investments required, what knowledge do we all need to do a better job, I think there can't be a better illustration than this week of why we need to support one another and work together, because right now, as I said, we have communities that are shut down, and it is the immediate local responses and the immediate community organizations that are currently going to be among the significant players and the first ones to help their neighbors see what the needs are and reach out. And if together across this province, across this country, we can share what we learn, share what we know in a world that's becoming more and more challenging on so many levels, we're stronger, our futures are going to be stronger, and we're going to be a healthier, better population. So as I say, I didn't have any written notes, but hopefully that gives you a little bit of insight into the history of the organization. We work to ensure that people can be healthy, active, and engaged and valued in community in this province. So thank you.
Great. Thank you, Helen. And your experiences there now certainly resonate with what we in BC have experienced in the last year or two as well. So lots of points of connection there. Let's hear from Karen now.
Thanks very much, everyone. Helen, glad to hear you're doing okay and safe there. Glad to be with everyone this morning. So a little bit about SAGE Seniors Association. SAGE has existed for a little over 50 years now and is one of the largest providers of senior services in the Edmonton region and across northern Alberta. SAGE works in partnership to provide a wide range of programs and services, most often to individuals that are experiencing barriers to accessing resources and supports to successfully age in community. SAGE began as an organization for seniors by seniors, developing programs and services that respond to gaps within systems, whether that be recreational programming to address social connection and isolation, social services, or community development. A lot of work in the area of trying to influence public policy and system development work, and most recently, an NP-led primary care program. There has always been a significant interest in how the social determinants of health impact the well-being of people that we serve, and the intersection between health and social systems that the seniors that we work with depend on. In responding to the needs of the seniors that we serve, we recognize that there was a lack of sector coordination and a valuing of the services provided within the network of organizations that we partner with in community and the services that we provide here at SAGE. In 2019, we partnered in consultations across Alberta, where we identified a groundswell of support from community-based senior living organizations and allied partners for the more formal development of a sector here in Alberta that would work systemically with other systems like health and housing. At the time, there really wasn't a senior services sector, and there was no organization here in Alberta mandated to coordinate community-based senior services at all. We recognized that we didn't have a collective voice to share the stories of the work that we do and the impact of that work happening within community-based senior serving organizations. With limited collective opportunities for advocating for systemic investment in those services, it created a vortex of competition, lack of collaboration, and very few communities of practice. So echoing many of the stories that have already been shared this morning, I'm sure there'll be more. That was the impetus for the development of healthy aging in Alberta. Very similar to the stories of our colleagues in BC, we very much mimicked our work here in Alberta on the good work that was happening in BC, inspired by that work. Which Healthy Aging Alberta acts as a mechanism for the development of a community-based senior services sector here. We have been extremely fortunate to have the support of our Ministry of Seniors and Housing within our provincial government. And this work has been undertaken within a framework of what we call a co-creation approach. Ministry staff have respected the need for the work to be led by community, but have provided significant financial and staff support for the work. Why now? Why in the midst of this effort? Or why are we seeing a prioritization of this work right now, particularly during the pandemic? It really accelerated this work when people were already very, very stretched in their efforts to run their organizations and deliver frontline services. And much like many of you, just an increase of demand for services, a shift here in Alberta in health policy towards community-based services away from facility-based care that really necessitates the need and opportunity for community-based organizations to respond to that policy shift. Demographic changes that province that traditionally has been a very young province, so really trying to respond to that demographic shift. And I think a shift in the collective mental model we have across government and community about the value of these non-medical supports. And I think we didn't yet have clarity on a systemic approach to how to structure and resource these services. And I think we're getting closer to that now. So that's the why now for this important work that we're doing together here in Alberta. So I'll turn it back to you, and I'm looking forward to our questions together.
Actually, Karen, stay unmuted, because next question is to you. If you could just tell us very briefly about your home care partnership demonstration project. How does it work, and why is it an important innovation? And what are the limitations, if any, and how would you like to see it evolve over time?
Yeah, I'll try and summarize that concisely. There's lots to talk about. Once we established Healthy Aging Alberta here in Alberta, we developed the approach to working more systemically with our colleagues in government, in systems like health, and through community consultations, we identified that non-medical in-home supports and social prescribing were key programmatic priorities for Healthy Aging Alberta and for communities across the province. In Edmonton, with investment from a small grant from our provincial government, We've begun a project that supports seniors recently discharged from hospital, working with our transition services coordinators in hospital, usually social workers employed by our Provincial Health Authority, to ensure that individuals have access to the non-medical supports in communities such as housekeeping, meal delivery, supported transportation, as well as supported navigation and case management through community-based organizations that enable them to live successfully in community and avoid those hospital readmittances that we're trying to prevent, and movement to higher levels of care prematurely. The project funds include resources for those that do not have access to those services on a fee-for-service basis because of limitations in their income. That was a gap in our service here previously. We recently received confirmation of further investment in this model to expand the role of link workers. We didn't previously have a social prescribing model in Edmonton, so we're really excited to incorporate that important role in our system, and to expand that referral pathway to include primary care and our Provincial Health Authority's home care case managers as well. So it's the first demonstration project of social prescribing and supports amalgamated together in the Edmonton region, and it'll include the development of standardization of things like the link worker job descriptions and opportunities to tie in the provincial social prescribing network that LPAG Alberta is developing. And we think it's an important innovation because it's the first investment that we've had to formally connect our primary care and transition services systems to those community-based senior organizations more formally, as well as some resources, probably not nearly enough, to bolster some of those community supports so that we're not referring into organizations that are so strained they just don't have the resources to respond to those referrals. That's always a risk. And that this creates opportunities around data collection and evaluation to further support how we build a case for support for further investment in those community-based supports. And so, yeah, and just looking at some consistency around case management tools and screening around things like frailties so we can benchmark the impact of those services, and a language that we hope our colleagues in health systems will understand. Again, going back to the valuing of these community-based supports. A limitation would be just the scope. Currently, the funding is precarious, it's grant funding. We have a history here in Alberta and probably elsewhere of not investing in good outcomes after demonstration projects are done, so that's a concern. And the issue around recruitment for demonstration projects, short-term funding makes recruitment very, very difficult, and trying to get buy-in from our colleagues in health systems for demonstration projects can be a concern, right? Lots of investment of time and staff energy for short-term projects is always a challenge. So those are some limitations of the project right now.
Well, thanks, Karen. I actually heard about the first social prescription to a men's shed in Edmonton last week at the Cold Lake hosted BC Men's Shed Alberta Men's Shed Conference. I was so excited to see that.
Great,
and it's actually just a terrific example of how social prescribing, how men's sheds and so much more of the work that we're doing can really be integrated and what difference it's making.
Thanks for sharing that.
Great, thank you. Let's go to Sue to tell us very briefly about your Links Wellbeing project.
Yeah, it's called the Links to Wellbeing Social Prescribing for Older Adults project, and it is a partnership between the OACAO and the Alliance for Healthier Communities, which is a network of over 100 community-governed team-based primary healthcare organizations. And it's a 3-year project, and it began April 2021, is funded by an anonymous donor. I know that Karen may have touched on this, but just to make sure, you know, social prescribing is gaining recognition internationally as a structured approach to better connect clinical care, prescribing, with non-clinical supports in the community, so social recreation, with an emphasis on delivering care that is person-centered, providing people with the power to direct their own care in a supported pathway. So the purpose of the Links to Wellbeing project is to support older adults who may face negative health impacts from social isolation and loneliness, and may have a lack of or limited connections to social and recreational opportunities. And as I said earlier, we have this wonderful resource of almost 300 seniors active living centers across the province. And sometimes they're an unknown, a little gem, a secret in the community. So our project creates intentional integrated health and social pathways between the primary care providers and the SALCs, and it improves understanding of non-clinical interventions on well-being and service utilization. We are doing some data collection to prove impact, saving the healthcare system money, And then there's also some national scaling and outreach that we're doing. There's a provincial social prescribing community of practice. There's also a national community, social prescribing community of practice. Maybe some of you hopefully are a part of that, and you're all welcome to be a part of that. We are working with CISP. So I'll give a little plug to CISP. Canadian Institute for Social Prescribing is a new national hub anchored by the Canadian Red Cross. And they are they have a launch on October 6th. So our social prescribing project is halfway through our 3 years. By the end of it, we will have 70 seniors active living centers engaged in the project. It's very grassroots. They reach out to their local healthcare providers. We provide connections to community health centers, and some are having amazing results with multiple referrals, and others are spinning their wheels a little bit. So we're constantly trying to create supports, outreach tools. We're currently, we just did a video shoot for a social prescribing video that we'll be launching next month, which is directed at those healthcare providers so they understand social prescribing and the benefits, interviewing clients. We have volunteer link ambassadors in the project, so they're a peer-to-peer support to help the referred clients get engaged. There is some we're working on the buy-in from the healthcare providers, and there is some hesitancy from those older adults who are being referred. So trying to get them over that hump to that comfort level to get into the center. Because I know, having worked in senior center for many years, they literally save lives. You know, once they get in there, they may be recently widowed or new to a community. They come in and all of a sudden they have a social network. It gives me chills. It's such wonderful experience. They make friends that they go out for coffee with, not just in the walls of the center. So we're working hard to develop those outreach tools, and just we have a leisure guide probing questions that the volunteer can use to get those little interest pieces out of the older adult center. And it's building capacity for our SALC center, creating new members, a nice membership flow. And I guess the limitation is we're hoping that our project, it's not just a 3-year shelf life. It's an ongoing thing. We're committed to social prescribing. So it's not just based on this project. We're here for the long haul. Thank you.
Thanks, Sue, and thanks, Karen. And everyone just keep an eye on the chat box, because Diane is posting a lot of links to some of these initiatives, because I'm sure that you'll all want to know more about them, and we only have a bit of time to scratch the surface here. So both of these innovations reflect the importance of better linking the health promotion work that's at the heart of what we do in the CBSS sector to the more formal health system. I know there's a lot of work going into building these linkages in both Nova Scotia and British Columbia as well. So Helen and then Marcy, if you could talk a bit about the progress that you're making in building these links and some of the challenges that still stand in the way.
Thank you. First, I just want to say how I'm loving just hearing what's happening in Ontario, in Alberta. I think, which is the point of all of this, and just, knowing how many opportunities there are for learning just within this small group, let alone with the wealth of folks out there. So in Nova Scotia, I think one of the things where we are right now is really understanding what's happening across the province, and getting a real strong read on who's doing what, looking at things like Senior Centers Without Walls and what happened during COVID, and who, suddenly pivoted and did their chair yoga online, and who suddenly developed a warm line to be able to reach out to folks so they weren't isolated. Who wants to keep doing that but needs some resources to move forward with that or continue. I think Nova Scotia was a leader. The government, for a number of years, we had what was called SHIFT, which was looking both across the province externally, but also within government, to make sure all the individual government departments were talking to each other, understanding what was happening from each of their roles and perspectives for older adults from a health and well-being point of view, and making sure the silos were coming down, so information was being shared within government, and having commitments made to moving forward collectively, so that decisions weren't being made in one policy area that were completely counteracted by a decision made by another department. So that has been very positive work. And I think what we're seeing right now in our new, much expanded Department of Seniors and Long-Term Care, what was, I think it was a $25 million department, became a $1 billion department over the last year. And although long-term care is identified as in the name specifically, you know, there's work across the board at understanding, and part of that is what we've been tasked with doing, looking at what's going on at the community organization, senior serving community organization place. But there's a significant effort being made to get a read on and then figure out how to do better at the home care front, at the community front, as well as, you know, moving people out of alternative level care beds into, where necessary, long-term care beds. Like there's a lot of energy, a lot of dollars, and a lot of research and real commitment across the board. And as I say, trying through us and with many others, trying to understand what's going on at the community level, so that we can continue to support that effort from the community perspective, and make community the equal partner or the significant partner, recognize the work that's involved and the contributions. We are the third leg of the stool, and we're not shorter, and we're not, you know, we're not supported as well as a sector, but again, collectively, that's why we're sharing our conversations and helping elevate our voices. So I'm going to go over to you, Marcy.
Thank you. Yeah, it is wonderful to hear everyone speaking. So much to share. So I'm going to kind of go back and talk about how we did build a relationship with the Ministry of Health, and really focus on that. You know, when we started, what we tried to do right from the beginning was tie what we were doing with what the priorities were in the ministry. And at that time, it was primary care reform and integrating home and community care. And so in those discussions, the government actually acknowledged that they hadn't even considered our sector in their planning. They hadn't even known that we were going to contribute or had something to contribute to help people live at home. And they actually kind of was an aha moment for them. And they made a commitment based on that to fund our initial work of, we'd gotten funding from the community, they matched that funding. So they bought in right from the beginning with some funding. It wasn't a lot of funding, but it was hugely important for us. And what that funding did was the literature review, so bringing together the evidence. And then it also was consultations with local communities and regions across the province. So that's where we learned so much about what was in fact working, and where the changes were needed. And all of that we compiled in a report, and we used it with our next level of discussions with government. And in those discussions, we focused on a provincial infrastructure that would support local capacity building for everyone throughout the sector. So like our online core, and supporting the Leadership Council and leadership development, et cetera. But also what came out in the regional consultations is that in many communities, there was a need for some new programming approaches, because we were dealing with more vulnerable seniors, often from low-income, marginalized communities, who were in fact living at home for longer, but they weren't doing well. And they didn't have the supports they needed, and the services weren't provided in a way that worked for them. So in asking Ministry of Health for programming dollars, we really focused on those populations where there was this overlap for the people who needed both support from the health system and from community-based services. And while we did get the programming dollars, the places where we were not so successful was building this relationship and the stronger linkages with the health system. I mean, we have social prescribing. The pandemic totally kind of messed all of that up. And so what has been an issue from the beginning is that the linkages with the health system are based on individual relationships. And when the person moves on, the relationships often end. And where we're going now is that we need to see those linkages built right into the structure. So there's actually policies and processes to facilitate referrals back and forth between the sector for sharing information. And so that we can also develop joint strategies to deal with key public health issues like emergency preparedness planning moving forward, which is like obviously accelerating and so essential, but also issues like hoarding that affect, a small group, but super important for both of us. So that's kind of, that's that piece. And as I mentioned earlier, where we're at now is that for the first time, government is sitting down with us. They're sitting down with us well ahead of time. They're interested in working collaboratively with us around how we're funded overall. And interestingly, really interested in an interministerial committee. So Helen would like to learn more about that committee and your terms of reference and anything you can send me on it. Because what we're finding is that we've got food insecurity issues that are huge and much bigger than the Ministry of Health. And the Ministry of Health can't handle it on their own. We have housing issues and affordable housing issues and housing with support issues, which we need housing for. So that interministerial committee is absolutely essential. And we're just on the verge of trying to get that going because both the government people in Ministry of Health and ourselves are very committed to moving in that direction. So something very concrete we can get benefit from you, Helen, on. So I just mentioned one other thing that we're talking to the ministry about, and that is to try to create up some core program infrastructure in local communities where we have staff, 20, 30 positions to begin with, maybe fewer to begin with, but building up. But where we have staff that work for a lead agency, but are actually working in consultation with the entire community-based sector in developing their work plan in their region or in their community. And so that it becomes more of a collective effort. And these new positions will be focused on these, if we get funding for them. Where we want to focus them is on this relationship building with the Ministry of Health. So we really have dedicated resources to work on that. And of course, also with municipalities. So that's the first, relationship building. The second is the emergency preparedness planning and working on that more intensively. And then the third is developing a more strategic approach to volunteer development, because volunteers are more essential than ever and more rare than ever. And we need that for the sustainability of our entire sector. So that's kind of our current big push with government. And, we have quite a bit of support inside the Ministry of Health. Over time, that's built up and grown, like we hear from other places. But not so easy at the political level because there's so many different pressures on government for funding. And that's really a place where our Leadership Council has been useful, because many of our agencies really have very good relationships with their local politicians, local, provincial, federal politicians, and they really can help us in advocating for these services. And that's really important. And it also speaks, well, as everything has so far, to the value of us working more closely together at the federal level to raise the profile of the work there and to get more support from the federal government. So that's kind of my little spiel on building those relationships. Challenging, but really, really important work.
Please stay unmuted, Marcy, because I want you to just kind of talk, you've kind of touched on it, but if you could talk a bit more about the tension between taking a real health promotion prevention approach, but also the need for the higher needs or more frail seniors, and really having targeted or direct programming for those groups. Can you talk about that a bit, please?
Yeah, thank you for that, Barb, because really that is a huge issue for us right now who are in these negotiations with government. That it is an area of tension. Government is always trying to push us because of the pressures on them and because of the higher needs people and things breaking down. They have all these people that they need to deal with that are in real crisis. But we know that that we need as a sector to continue to be open to every senior who wants to walk through our door. We have to have that kind of a place where people come as community members, not as patients or clients. where they, even if they have higher needs, they feel part of a community that's strength-based and positive. We have to hold on to that. That's what makes everything we do work. So it's something I yes, feel very strongly about, and the research totally supports. And, when we look at those communities and regions in other countries that have been most successful and have taken a really comprehensive approach to prevention, they do both. They do both the primary prevention and they do the prevention connected more with the health system. And it's that more comprehensive approach that I think we have to make as our mantra. So that's kind of, that is something that I really hope that we can pick up on as we work together more across the country. And just one practical thing that we've been able to say to government to kind of lower their anxiety is to say that most of the work with higher functioning seniors is actually done by volunteers, which is why we need their support for a more strategic approach to volunteer development. Where we need their dollars is it with the higher needs seniors. That is where we need most of their investment as a Ministry of Health. And in terms of also the seniors that are doing better, we can get other funding from donors, from community foundations, from other levels of government. And so for them to think about helping us with the infrastructure, but in terms of programming dollars, to focus on those higher needs folks. And so that's kind of how we've tried to work it through, at least in some beginning ways with government. And then, take it from there. So that's,
Great. Karen or Sue or Helen, did any of you want to comment on that tension?
I can jump in. I was just reflecting a little bit on how Alberta's development of our community-based senior serving sector, it's mimicked the work that's happened in BC and has been inspired by that work, but we're about 5 years behind. And so what's happened is, in part because of the pandemic, our focus has been on seniors with a high level of frailty and a need to take pressure off of our health system. And so our current focus is on working with seniors with a high level of complexity, and our government, of course, is very motivated to invest in that space. And so for Healthy Aging Alberta and our Cbss sector, our investment that we're receiving right now from government is very much in that space. But we have a gap right now in our toolbox in terms of our Cbss sector work around volunteer activation and around those preventative supports that Marcy's been discussing. And it's a real concern right now in terms of our ability to advocate for investment in that strength-based health promotion work that Marcy's been discussing. And so we've identified that as a key priority in terms of our strategic planning process this coming 2 years, because we recognize that, as Marcy's indicated, we are more dependent on very highly qualified, engaged volunteer workforce more now than ever before. And yet funding for volunteer coordination, volunteer management is a big gap in our system. So it's very interesting to see the parallels that are occurring across different provinces. I think this is why, this type of national conversations are so important. And so I look forward to learning more about how others are undertaking those advocacy efforts.
Great, thanks, Karen. So, just thinking about that, we've talked about a lot of different types of challenges, but are there others that we haven't yet discussed today? Other really significant challenges in the whole CBSS sector that you might be experiencing in your province? Karen, each of you, if you want to just in 1 minute, give a quick response to that.
One thing that comes to mind quickly, and I'm sure others can contribute to this, is the equitable access to technology, really emphasized during the pandemic. So there's a lot of rural communities in Ontario that just, didn't have it, whether you had a computer or not. The reliable internet and access to the bandwidth just isn't always available. So there's a lot of work to be done there still.
What about the rest of you?
Well, I would like to add that we've got this shortage of volunteers, but we also have a problem with recruiting staff now in the staff shortages because the nonprofit sector doesn't pay the same wages and benefits. We're losing staff and we're short-term funding. So that the whole infrastructure that we're doing depends on having a stronger recognition of the value of nonprofits by government and the funding that we receive. And that's a hard one. But it's also really important.
Right, Helen or Karen?
I would say that something we haven't touched on, but impacts everything, is ageism, and how decisions are made, and you know, how older adults are valued, and you know, that's a whole nother conversation. But I think it underlies much of the decisions that are made, the value that's put on the sector, the belief of the importance of the sector. So I think there's a lot of work that has to be done just on educating, you know, and it starts with us, obviously, but you know, it's universal, and it's not seen in the same light as other isms. I think it's not even kind of put in the same kind of priority place. And I think there's a lot of work that you know, has to be done alongside all this kind of pushing, you know, the specific needs for frailty and housing and food security, all those things. So there's that whole overarching umbrella that impacts what we do.
Thanks, Helen, and I'm so glad you mentioned that, because it gives me the chance to briefly let people know, if they don't already, about the National Ageism Consultation that is currently underway, initiated by the Federal Provincial Territorial Forum for Ministers Responsible for Seniors. I hope Diane can post the link in the chat box, because the survey will be open until early November, I believe. But you've only got tomorrow, until tomorrow, if you want to register to host a consultation in your organization or in your community. But there's a whole toolkit, makes it as easy as possible if you want to start talking about ageism and hearing from people in your community about their experiences of ageism and their thoughts, which will all be, the input will all be collected, collated, and form the basis of a report and recommendations to the FPT. So that's underway now, but if you do want to host an event, deadline is tomorrow, I believe, at end of day. So just go to the site and you'll get information, but please spread the word about the survey, because they want to hear about people's experiences of ageism, whether it's yourself, people you know, or you know, caregivers. So please take a look at that. Karen, how about you?
I think a key issue right now is cost recovery granting. It goes back to the issue Marcy was referring to, the cost of living for staff and the impact on wages, inflation for organizations, the lag in return of discretionary funding and fundraising dollars for organization. I just think investment in our sector has to reflect the actual cost of delivering services, and there's absolutely no ability for organizations right now to absorb additional costs. And I'm just really worried that this coming year is going to be an especially difficult year with the loss of any emergency funds or wage subsidies. I think we're really going to see the rubber hit the road for a lot of organizations, and I worry about our sector. So cost recovery granting is my wish for the year.
Great, thanks, Karen. So one last question for our presenters, and again, if you can keep it to a minute or less, what do you see as the benefits of creating a network of networks that links provincial coalitions and organizations like yours and others across the country? Karen, you may as well start.
Well, we've seen so much benefit provincially and regionally, and even just the mentorship we've received from our colleagues in BC on the development of our sector here in Alberta. I just can't say enough about the opportunity to connect with all of you and with our colleagues nationally. I think there's different ways that policies and funding structures are implemented regionally and provincially and nationally, but there's a need for commonality around strategic priorities that affect, the majority of seniors that don't live in facility-based care, that live in community, and that it's a unique experience serving that population. And we need to connect with one another to be at our best with the limited resources we have. So I think it's a huge opportunity.
Great. Marcy, do you want to go next?
Sure. So for me, what I see, I am really, all this opportunity of connecting on so many issues, but I do think right now there's a particularly important issue, which is that there is federal and provincial discussions about more funding and more funding for seniors. We are related to different provincial ministries, and in the federal government, it's the Ministry of Health that works with the Ministries of Health, but we did manage, or our Ministry of Health, in the last agreement that they had on funding that was focused for mental health and seniors, they did include funding for our sector as part of their bilateral agreement. So we're written right into that agreement. And I think that more work that we could do, because in the next 6 months to a year, those discussions are going to be happening for more money. And we want to make sure that more money doesn't just go for facility care, that there really is money to support people living at home and the value of our services. It's what seniors want. Some people need long-term care, but most people want to stay at home, and we are key to that. And so I think working with Help Age, with each other, we could potentially have some influence over those discussions, and I think that would be super valuable.
How about you, Sue?
Yeah, I want to echo what has been said already, but we've got such a wonderful sector. Why recreate the wheel? We share best practices, we support each other, we learn from each other, right? Let's pave the path together rather than individually. So I think by creating a network of networks, there's great value in that.
Great. And Helen?
I think it's been said. I think we see so much splintering and siloing among organizations where we could work together, share resources, share knowledge, both within our provinces, but across the country, and not compete with one another, because it is, that scarcity mentality is terrible, and to live in kind of a fear space instead of a growth space. I think this kind of thing allows us to grow stronger together.
Great, thank you, all of you. Didn't I say that we had some really terrific presenters who bring a wealth of information, and I saw lots of activity in the chat box wanting to connect with them. They may be inundated, but we are going to talk in a moment about how we can keep this conversation going on and share more information and experiences. But first, I want to introduce Gregor Sneddon, the Executive Director of Help Age Canada, and they're a partner in many of our United Way of British Columbia and Core Canada programs. In fact, some of you might recognize Gregor as the host of Core Canada's On Aging Canadian Conversation series, which, if you're not familiar with, check out the Core sites and the e-news, because those are half-hour conversations every 2 weeks that bring in leaders in healthy aging and expose you to some really interesting thinking and innovations in that area. So over to you, Gregor.
Thanks, Barb. I have to say I'm just so thrilled to be here and inspired to be with our panelists, my colleagues and fellow visionaries for the CBSS. I hadn't had the opportunity really to hear them speak about their background and history and the development of the sector in their areas. In our many of our meetings, it seems that it's me that's doing the talking. So I really felt moved today to hear from all of you, and it's just a real privilege to be here. Just, I'll be brief. A few words on Help Age Canada. We support community-based initiatives through partnerships across Canada and abroad to improve the lives of older persons and their communities. And we have a uniquely wide charitable mandate that is national in scope. We're a founding member of Help Age International, a global network. And in Canada, we work in a number of different areas. We have programming in the age-friendly transportation space. Digital literacy is big for us, including an intergenerational program up in Nunavut. And we have grants that address isolation and loneliness, including the Men's Sheds program, as well as the Canada Home Share program, which matches overhoused older people with students. And, for us, really, it was back in I can name the day, March 13th, 2020, when the federal government announced the pandemic, that we were able to move very quickly and launched a national campaign for humanitarian relief for older people. And, we were going around the country pretty much, Googling and calling, where are the organizations that could really use our support? And we would just find an organization and you'd get an exasperated executive director or frontline person on the phone. And do you guys need help? Yes, we need help. And so we were able to provide this mechanism to be able to provide some funding to support them until the government came in with the Community Emergency Support Fund, after which we then identified gaps, and particularly isolation and loneliness exacerbated by the pandemic, and we moved into the digital literacy space and providing grants, providing devices and data-enabled devices, especially for rural communities and digital literacy. And once again, we were searching around, through our already established network, but developing new ones. And what really became so clear is that, as all of our panelists have been saying, is there isn't a united body of this sector, the community-based senior services sector, which we know firsthand is the heartbeat of the country in terms of serving older people. And it is rightfully a sector like any other sector, health, transportation, housing, and really needs to be recognized and a national expression, a national collective voice, and sharing best practices and so on, as our partners say. Lack of core funding. Once again, we're all spread out in terms of short projects, and again, executive directors and even frontline staff just don't have the funding to make the ends meet. And this is the common voice right across the country. So, Help Age Canada has really chosen to step forward to try and assist and support, to help convene, aggregate nationally, to do what we can to help build some scaffolding networks, capacity, and create space for this relationships and dialogue to support the emergence of this sector in its own right as a Canadian standard of total holistic care and social cohesion. And we look to continue to support and nurture relationships with all of the CBSS organizations in every province and territory. And in fact, we're thrilled to announce that we are, along with our provincial and territorial leaders, which include Karen, Sue, and Helen, will be hosting Canada's first CBSS National Summit in June of 2024 here in Ottawa, entitled Claiming Our Space, Naming Our Future. And this will be an opportunity to gather as a pan-Canadian sector, to really declare and even self-define our identity, to share our needs and priorities, and create a vision for a common future where our strengths and gifts are amplified in the service of aging Canadians. And we're so excited to work with Core Canada and all of our partners from coast to coast to coast. And again, are just humbled to be with these incredible leaders today. So real privilege to be with you all, and please do stay tuned for the upcoming summit. It'll be rattling through Core Canada and through our channels over the coming months.
Great, thank you so much, Gregor. And I'm sure that you'll all be hearing more from Gregor and from Help Age. And Diane has put the link to Help Age in the chat box. And Diane, I believe there is a question or two, if you wanted to pop in and direct that. And sure. Then we're also going to provide a bit more information before we wind up.
Yes, I do. I have a few questions that I've been keeping track of here. So the first one that came in is for Marcy. What kind of health promotion activities in your program were found to be particularly effective to enable healthy aging at home? Was it nutrition, social activities, physical activities, something different other than that? What can you share?
Yeah, well, I think it's all about social connection for sure, and building that trust and that relationship so that people can feel like they may be asking for something practical, but there may be something else happening underneath that over time they come talk more about. So it is definitely building those trusting relationships where people feel safe. And it's all of those things: nutrition, practical support, just being able to connect with someone, go out, et cetera, et cetera. One of the things I said in the chat is that increasingly where we're going is we're having to deal with the fact that people don't have housing that is affordable, and that there's more and more people that are living in housing precarity for various reasons. I mean, even people living in their own homes in rural areas where there is no alternative, but they can't get any renovations done to make the housing work, to, people living in apartment buildings in cities where bringing in supports to those housing units would really make a difference. So that's kind of the new area where we're looking at and beginning to try to develop some relationship with housing providers.
Nice. Did any of our other speakers want to add to that? We're always looking for practical ideas for, health promotion activities, and especially, around equity and the social determinants of health that I know Karen mentioned for sure. So anything else to add in terms of activities or examples?
Any more questions, Diane?
There is one more, which may have already been answered, but I just want to make sure. So at one point, there was someone was mentioning about provinces, territories, and Indigenous communities that have government-appointed seniors advocates or ombudsmen that provide, some sort of focus on issues of concern for seniors. And so I think it might have been answered, but could any of the speakers respond to that again? And then, if not, are there any other advocates, appointed senior advocates, not at those formal government levels?
So I guess we have a seniors advocate in BC, and it was the community that advocated for that position. And she's been in place for 6 or 7 years. There's some incredibly good things she's done, particularly in terms of highlighting the low income so many seniors experience, and the exclusion of so many seniors. And then she's done work in different areas. I have to say, she hasn't always appreciated the value of our work and the importance of connecting our work to the sector. So it hasn't always been easy building that relationship with her, but having that role and being able to profile the issues of seniors and having an office that's working on that and supporting that kind of systemic change is definitely a way forward for other provinces if they want to replicate what we have in BC. Hope that's useful.
Nice. Yeah, thanks. Anyone else?
Alberta had a seniors advocate that was embedded within the Ministry of Seniors and Housing. And so the placement of that role created, I think, some challenges in terms of the ability of the advocate to influence public policy. And then when there was a change in government from the NDP to the current UCP government, that position ended. And so we don't currently have a seniors advocate. And I know that there is work and effort underway with a lot of community-based seniors advocacy groups to try and advocate for the reinstatement of that role and to potentially change the way it's orientated within government. So that work is currently underway. So there is not currently a seniors advocate in Alberta.
Okay, I didn't think so.
Great.
Okay, I think that's it, Barbara.
Great, thanks, Diane, and thank you again to the panelists for responding to those questions. I think there was a lot of activity in the chat box and some questions answered there, but I'm sure that people will have more questions going forward as they encounter different things or wake up in the middle of the night. And so I just want to remind everybody that these sessions, the one today, it's just a starting point. It's just the beginning of the conversation. All the sessions will be recorded and made available as a resource on Core Canada, but we'll also be sending you the link in a follow-up email. We'll also be alerting you to other related resources. And you saw a lot of the links in the chat box to some of the programs that were talked about. In addition, for each theme of these health promotion sessions, we'll be creating a group on Core Canada that will serve as an animated online community where participants can continue to ask questions, share information, collaborate, and engage in peer learning and mentoring activities. Still in the very early planning stages, not quite ready yet, but will be very soon. And we anticipate that this series will foster development of that network of networks that we talked about in the last question to the panelists, and that it'll focus on health promotion for older adults, and that Core Canada will support the connection among the agencies and the networks as needed, and it'll grow and take the shape of the users of the network. So now, because this is a series and it'll continue on, we've just announced the first 3 topics, but we'll soon be announcing ones that will take place in 2023. But we want to hear from you, and we'll do it in a fun and creative way. So some of you might be familiar with the Mentimeter. There will be a link in the chat box. I think it's already there. If not, it will be in just a moment. And here's the link on the screen, menti.com, code 4142730. So go to that link if you can and share your thoughts in just a word or two or three about what topics discussed today are you interested in learning more about. And then Gemma and Jean will share the screen so that we can see the word cloud that you're creating grow. And the size of the words and phrases indicates ones that were repeated a number of times. So I'll give you a minute to go to that link, and then we will start showing the word cloud as it grows. So someone is asking about the code again. It's 4142730 at www.menti.com. So as I mentioned, we will be sending an email to everyone with the link to the recording for today's session. We will also, once this word cloud starts growing and shows what topics people are interested in learning more about, we can include a PDF of the word cloud. And also we want to know who of you participating today is interested in following up. We can organize another session with our presenters and perhaps others to follow up on what we've talked about today. And so in that email we send you, we invite you, if you are interested, to respond back. We'll provide an email and keep track of those who do want to continue this conversation and then be in touch going forward. So you'll see the word cloud is starting to grow. Housing, I'm not surprised, is a really big one, and ageism, of course. Someone is saying they can't get into.
Can I just interrupt here? I just want to thank Gregor. I'm new to Help Age, but I really think that you have a really valuable role to play in helping us come together. And I'm so glad with our core platform that you will be working with us in that. I think that's going to be really helpful. And we'll figure out exactly how, that's kind of what we're going to learn after this. And when people say who they're interested, who's interested, and how do we organize the topics and how do we do it? But obviously there's so many ideas that have come out already. It can't help but be something that moves forward and is going to make some difference. Oh, look at those things. Look at them.
Yeah. Yeah.
Well,
great.
thanks, Marcy. That's really kind. But you're truly a pioneer for all of us, and you really are inspiring all of us. And it's just a real privilege to be together and to find the way together.
Great. Well, thank you both, Gregor and Marcy, and thank all of our presenters. And also our Health Promotion Series Advisory Group. I mentioned all of you earlier. We also want to thank Jean and Gemma for keeping us on track with the tech. Really appreciate that. But thanks to all of our participants for taking time out of your busy day to join this session. I want to give a reminder for the next two sessions. Maybe that can also be posted in the chat box. I thought I had it handy here, but same 10 o'clock actually, last Thursday of the month in October, and then again in November. October's topic is age-friendly communities, and November's will be on housing for older adults in place in communities. But we're going to give the last word to Irv. We want to thank him very much because his decades of work actually inspired this series, and so we'll give him the last word. Irv?
Okay, well, thank you, Barbara, for your excellent moderating of this session. On behalf of Health Promotion Canada, I also want to thank the United Way of BC for hosting and organizing the webinar, and especially you and Marcy for developing the program. I also want to thank the National Collaborating Center for Determinants of Health, especially Diane Oikel, who has been a great person to work with. during the first 5 webinars based on our book. These webinars are all recorded and are available through the National Collaborating Center on Determinants of Health. I look forward to the next 4 webinars in this series and hope that all of us, all of you that have attended this session will attend all of the other sessions. So thank you very much.
Great, and thank you, Irv. And again, thanks, Diane, for your behind the scenes work and your connections with the center, which I think will be really increasing going forward. That's really exciting. So again, that network, just organizing these sessions has been a great way for us to connect some networks, and we'll continue to grow that. So thanks again to our panelists and our behind the scenes folks, and to all of you who participated. And thank you, Irv. And if people haven't seen the book yet, make sure you check it out. It's pretty awesome. Take care, everyone. Have a great rest of the day.